Hello, can you hear me? The world is actually facing many different forms of crisis and challenges. So forcible displacement is one of the crises that is happening in many parts of the world, and Bangladesh has recently witnessed this humanitarian crisis and is still working with the humanitarian crisis management. So I am from Bangladesh, a home of 163 million population, and giving refuge to another 1 million population in our country who are forcibly displaced, brutally tortured in their own country, which is Myanmar, killed, raped, and thrown out of the country. And they were completely didn't have any access to basic health care in Myanmar. And that happened during the period of August to September and October 2017, the huge exodus of population. So as a development worker, actually, I also arrived at Cox's Bazar, which is very at the coastal belt of Bangladesh. It was 11th of September 2017, and I was completely shocked and traumatized to see the brutality. I can't believe my eyes, the thousands and thousands of people who are actually sitting alongside the road, the women, children, elderly, men, completely helpless with blank look. I was totally shocked. I saw injured body lying on the roadside, a burned body, a person was almost dying because his body was completely burnt out. So that has completely shocked me, and I came back to my office, and next day we prepare ourselves. We have to jump in, we have to work. So that's how you started working for the women, for the children, for the Rohingyas population who are forcibly displaced from their own country. And what happened that I met with one lady who was sitting, her name is Mariam. Mariam was actually sitting with a small baby, about 9 to 10 months old, and we don't have the same language, so I was trying to communicate with her, and I found that she lost her husband, other family members, so she came only with the baby. So I touched the baby and tried to see the arm, and I couldn't find any scar. And then I was scared. I was not only shocked, I was scared that, those kids were not vaccinated, they're never vaccinated. I can't imagine. That means that, this country, we won't be able to save these children, then women, and we will also won't be able to protect our host population. So I actually, myself, personally, I felt that I should talk to the ministry people. They're our friends and colleagues, and met with UN, then also WHO, and I also wrote a letter to Gavi. Personally, I felt that it is so important. And then, Bangladesh actually very successfully managed 2 outbreaks, cholera, diphtheria, and then routine immunization has started with the support of Gavi, UN organizations, and indeed, the Bangladesh government was really, really very generous to provide all kind of support. And role of civil society, Bangladesh, so in this country, the civil society has a great contribution to all management of humanitarian crisis. But then what happened? Because these are the children, they will be staying, and we don't even know that where they will be going, because they are stateless in their own country, and they are becoming doubly stateless in Bangladesh. And with the refugees, we don't even know the future. And then what happened that I met with the women, the adolescent girls, and the women are also dying from the maternal deaths. Women are dying from many different causes. And second killers, we know that globally is the cervical cancer. Can you imagine? The cervical cancer vaccine has not yet started in Bangladesh, which is actually a very successful country in many different areas. But think about the HPV vaccine introduction in the humanitarian setting. So humanitarian crisis should not be treated as a standalone intervention, because this is happening across the world in many different forms. As I say, sometimes natural disaster, sometimes humanitarian crisis, sometimes flood, sometimes climate change. We don't even know, even the displaced population in urban areas. Think about all those populations. So what we can see that one magic solution is the vaccines that could prevent diseases, deaths, and save lives and give some decency, dignity to the lives of the human being. And the women who are actually dying from cervical cancer, we don't even know that how many are actually dying. In Bangladesh, you have data, it is 7,000, 12,000. We don't know. It could be more than that, because it's the second killer in the country and globally. So my lessons is that we should not treat humanitarian crisis as a standalone program. The development and humanitarian crisis management should be happening together. We should give more attention to all those things that could be prevented. And we should have a world with dignity that people have, and they have the basic rights to have a decent life. And more importantly, to achieve the sustainable development goal, we don't want to leave anyone behind. So what can you do? We have to treat each and every person to be as a human being. So the human touch, the love that Bangladesh has given to all those refugees, I think we should treat each and every person as a human being, and the rights to life is everyone's rights.
Great, thank you. Thank you so much. You know, if the question is cervical cancer, a really good answer is HPV vaccine. Really, it needs to be every place, because we can end the horribleness of cervical cancer, so do it. Now, one quick question to you. You've had a very difficult, troubling situation in Bangladesh. What is one insight you've taken away that could be done differently in another situation that's similar? What's one lesson you learned?
What I feel that when I first saw that Rohingya populations, I felt that the basic amenities they have missed out in their own countries, that means they have missed out many things. It's not only healthcare, that's education, the empowerment, and many things. So when I saw, because I am the organization I work for, we work for the empowerment of women. So I feel that, you know, empowering, when I met with all those Rohingya women, seemingly they look disempowered, but they are actually not. So the voice of the women is really important to bring in. Right. So I would love that they should be more empowered, and we should listen more to them.
Well, you know, that's like HPV vaccine. If we want to basically change a lot of the problems in the world, there you have the answer. We need to empower women, and it's that self-power that comes from education and healthcare and nutrition, and working together to make sure girls and women everywhere have those opportunities. Thank you really so much.
Thank you very much.
Thank you.